And a short story that I have for you is that one of my visits to Chile, unfortunately, McDonald's has come to Chile, but they are very, in terms of, very savvy in terms of public relations and all of that. So they know that Chileans, when they go to eat, they sit down for a long time. So then they created this atmosphere so that they have this grand piano as you enter to the right, and then they have pictures of, national poets and all of that. And I had a good laugh, but in a way I go, that's the way that you relate to people, or how you go into the culture, so that in a way you will have customers. So that, sort of similar to that. I'm not recommending that you create a McDonald's and so that people come to it, but at least, in terms of, is it reflected? The pictures that you have, it's something that they will feel welcome. And then volunteer management practices. Who volunteers at your clinic? Can you have representatives of the community, just starting to involve them, so that then when they go out there in the community, they are representing your clinic, but they are part of the community. So here are some tips. It is always very important that you have a team ready to go, and then you set a timeline for conducting the assessment, and then in your package, you have handout number 1. And we are going to take a look at that one for 1 second. There are many different assessments, organizational assessments out there, and not very many that have to do with reproductive health. So we really researched and included in here questions that we thought that would be very pertinent to reproductive health, but we included, the first few are at the agency level. And you can see them in there in terms of the questions that are asked, at a minimum, that the agency do this. And then also the program itself, and here are questions that are related to reproductive health, and it asks the questions about your program. It even asks about, the reception stuff, how, in terms of cultural competency, and supervisors. We found that when we have sort of gatekeepers, not only from the community, but gatekeepers within the organization itself, that they are going to move this process and that they're committed to it, that the clinics were a lot more successful in implementing this process. And then questions about interpreters and bilingual staff. So this is a tool that you can also find at the website that I just mentioned a few minutes ago, www and funplan.org. And then you can build on it, according to the needs in your community or the questions that you want to ask. They are right there for you to use. They're not even PDF, because we know that people can use them, and you're welcome to do so. All right, this is a strategy number 2, and then also, as you heard from our colleagues that they spoke about the radio drama a few minutes ago, that is very important to create a profile of the community that you want to serve. What do they look like? What are the demographics? And you can utilize data from the census. Hopefully many people in your community have been really filling that out so that we can all count. And so this way you will know what is in the community, what resources are already there, what assets are there, and then the needs that are there also related to family planning. And then I gave you 2 tools that you can look at. Handout number 2. And handout number 2 really gives you many good resources of where you will find information or how do you get a quantitative information. And what I want to point out in this form is about qualitative information and how you go about in terms of how you are able to get information from the community that is reliable. And the colleagues that presented before, they said, we did sort of like a focus groups, and that is something that we have found in other work that we have been doing in the community that is very important. That's how we have found out more than any other way about the real needs and what people really think about reproductive health or sexuality. And so then we're able then to create services that are going to respond directly to those needs. So this is a very good start page of where you find the different sources. And handout number 3, that is all the online websites where you go and find different information, whether it's statistics, demographic data, HIV/AIDS, and teen pregnancy data. Another very good tool, and also from all the different national organizations. As I mentioned before, that is very important then, once you have surveyed the community, and then once you know what the needs are, and then you have your staff ready to go, it's very important then to really provide ongoing development and training for your staff. For example, skill building in attitude change and in awareness of self and others. And I think that there are many different trainings that are done that help an organization to really do soul searching about why we need to serve the community and where are our weaknesses. And the National Center for Cultural Competence, they provide trainings online, but then also they provide trainers that can come to your organization. I do trainings like that, I'm sure actors and some others, but it's very important then to really do that piece in terms of not only what are my biases, what are my values around these issues, but also how do we work together within the organization itself. Training in linguistic competence. This is, as I said before, is very important. We were working with an organization in Connecticut, and they have done many different steps. And then when it came to hire bilingual staff, and it was time for them to start working within the community, they didn't know the language, the reproductive language. They also, as Hector mentioned before, and some others, that they didn't feel very comfortable with their own sexuality or with the body parts and all of that. So it's very important, even if people speak the language, how comfortable do they feel? And then there are trainings that are specifically for bilingual staff to be able then to be health communicators or health educators. And then very important then to also develop competence in cross-cultural assessment, communication, and negotiation. We all communicate very differently, and so it's important then also to take the feel of how staff is feeling within the clinic.